I was also asked to talk about pain. Now, they call it labor for a reason. It's because it's tough. And we do have things to help you out with that. So labor is hard work, and sometimes we need to help you out by giving you some medication to make things easier for you. We have a lot of different choices. We've got that laughing gas stuff that the dentist sometimes uses. We call it Fentanyl. It's got some nitrous oxide in it, and it's got oxygen in it. It's actually got more oxygen in it than room air does. So if you're breathing on this laughing gas stuff, you and your baby are actually going to get even more oxygen than you would if you were breathing normally. So we're not worried about that. Sometimes we'll give you some medication either into your vein in an intravenous or into your muscle. There are medications that are narcotics that we can use. Some of them are very fast acting, and we're not worried about them lasting long with the baby. Some of them are longer acting, and we would use them when you're earlier in pregnancy, but not when you're later in pregnancy. Now, one of the drugs that we do use in pregnancy is called fentanyl. And I don't want you to be scared about that, because obviously everybody knows what fentanyl is nowadays with the stuff that's going on. But if it's used properly, and it's used by a physician, it's not going to cause your baby problems. You're not going to get addicted to it, but it will help you with your pain. So if we talk about using fentanyl, I don't want you to be scared about that. It's a short-term thing. It's going to help you get through the labor. It's not going to give your baby problems long-term. It's not going to give you problems long-term. We can also ask the anesthetist to come up and give you something called an epidural. So much like earlier when I talked about the spinal anesthetic, the anesthetist is going to come up and they're going to paint your back. They're going to freeze up your back. You'll get that mosquito bite thing happening again. And then they have this skinny, tiny little plastic tube, and they're going to slide that just between the bones of your spine and the spinal cord. And there's a little space in between the two of those where they can put this skinny little plastic tube in, and then they can slowly drip some pain medication into that. And we can use that for as long as we need to in your labor. So and it doesn't mean that you're stuck to the bed. Nowadays, when we give you an epidural, we give you what they call a walking epidural. So it's more about pain relief and less about you being frozen solid. You should be able to still get up and walk around with your epidural. You should be able to still do the things that you normally do. And when it comes time that you need to push the baby out, we may turn it down a little bit, but you're still going to be able to push the baby out. It's not going to stop that from happening. The newer epidurals, the ones that we do nowadays, don't interfere with your labor. They don't slow it down. They don't increase your chance of having a cesarean section. Back in the day, back when my hair wasn't white, the epidurals were stronger, and your risk of having a cesarean section was higher. Nowadays, it's not like that. Now, we did also talk about spinal anesthetics, and that's the thing that we tend to use for cesarean section. It tends to be a bit stronger than the epidural is, but it also wears off more quickly. And an epidural where you can drip it in over hours and hours is different than a spinal where they put that needle in once. They give you medication that lasts for roughly 2 hours or so, but then it wears off and we only use it the one time. So that's more or less the difference between an epidural that we can use when you're in labor and a spinal that we tend to use more when you're going to have a cesarean section.